my first question would be, what do you understand the Obama administration to have said this morning about taking the public option off the table?
Well, I understand that there is a substitute, or could be a substitute for it. Since there has been so much talk about socialized medicine, which in my judgment does not mean that, but co-ops could very well be a substitute. But I think that unless we have something, there's not much point in talking about reform, because the same people will be uninsured. If the insurance companies won't insure them now, they will not insure them in the future.
Can I just, guys, let me just,
Absolutely.
one more. Related to that, I think a lot of people, myself included, are confused about the public option. It doesn't mean that people couldn't do private health insurance, or does it? It doesn't squeeze everything else out, does it, or does it?
Oh,
Just
no.
straighten me out on that.
No, what it is, the people that are not insured now, for the most part, cannot get insurance. And they cannot get it because it's not affordable. And sometimes it's because they are not in a health condition where the insurance company will cover them. We're saying that everybody should have access to insurance. If they cannot get it in the general marketplace, then it should be some other mechanism by which they get it. It is being labeled as a public option right now. It can be labeled anything that's appropriate. It might be co-ops, but it will put some competition in the marketplace so that insurance, it might even cause insurance to go down, because right now the coverage is getting less and the price is getting higher.
Would companies then be allowed to choose the public option if they're currently insuring their employees through a private insurance company?
That I cannot answer directly, whether companies can, but I'm certain that if at this point they have a large number of people that cannot be insured otherwise, that option would be open.
Is there growing tension between Capitol Hill Democrats and the White House on this public option issue? I understood you to say yesterday on CNN that there was no support without it, and yet the president's talking about moving to something else. Are you folks okay with
Well,
being on the same page?
There is a large segment of Democrats that do have a problem with the elimination of the public option, because that to us is the only answer for people that are not insurable otherwise. It can be called something else. It can be called co-ops or with a nonprofit organization, but it is not intended to be a large socialized medicine situation, but it is intended to put another option out there where people can choose. If their insurance is what they want, if they have what they want, they keep it. There's nothing to indicate that there will be any type of forced change. Right now, the health insurance companies have no competition. They all charge about the same thing. They all deny the same category of people from coverage, and they need to go somewhere, because otherwise the general public, whoever has insurance, is paying for it.
Congresswoman, do you understand, there are people out there who look at places like the Postal Service or like Amtrak, and they say, the government can't run these places. How can they run any sort of public health care system?
Well, I don't know that the government's going to run a health care system, but what I can tell you is this. The government has run the most successful program we've ever experienced, and that's called Social Security. And out of Social Security, the amendment of Medicare and Medicaid has run very well. I have not had that many. They have too much of a load, because now the insurance companies dumps everybody, no matter who they are, into Medicare first for pay when they get 65.
Congresswoman, isn't it tough to use Social Security, though? I'm told it may not be there for me, and I'm 40.
Listen, as long as people pay into Social Security will be there. Social Security is intended that people your age pay in, and the people that are retired share that. It's a social fund. I don't see the end of Social Security unless people decide they're just not gonna pay into it anymore. We do have people living longer, and it's taking, obviously it's gonna take more. But we're looking at some kind of a change in that, and I don't know what the end result will be, but now they're looking at perhaps making retirement a little longer than 65. People are healthier, people still are working. I'm getting close to 75 and I'm still working, and I'm still paying Social Security. So I think that will work itself out as long as we keep our eye on where we are. Now, Social Security is paying just about every other debt that we have. If we didn't take anything out of Social Security, we wouldn't have to worry about it. But that is not the case. It goes in the general treasury, and we spend it for everything that we need to spend it on. And right now, that's all probably on interest to China.
Congresswoman Johnson,
Which is why
as
you're
far as the
concerned.
people, is there really outrage? Are people really upset about what's going on? Is this media created? What is your personal take on how we're seeing citizens react?
Well, you know, the insurance lobby has spent already $100 million for lobbyists. To them, it's a death act to try to change anything about the insurance industry. They cover who they want, and mostly it's easy to cover healthy people that are working, and they don't want to be bothered with the rest of them. And so to say that they are facing a change is a real threat to them. They balkanized the effort in '93, and they are spending even more this time to try to interfere with it. People are making money going out and disturbing these meetings.